Okay, welcome everybody. Monica, Empower Your Health, Empower Your Life TV. At Empower TV, we connect you with health and wellness resources so that you can empower yourself and create the life you want and the life you love. So, welcome. Let's go. So today we have a very special guest, and I think this is going to be a very insightful conversation that will bring you some knowledge about things that you may not have thought about, and especially if you're a patient, somebody who's looking for solutions and help with chronic pain. Maybe you've had back pain or hip pain, bladder issues, whether you're a man or a woman, difficult periods for women, childbirth complications, C-sections, you name it. And that's been sort of, impeding and making it difficult for you to really thrive in your body. So my goal today is to bring you some new light and new perspectives and perhaps new answers into what you could be looking for and where you could find help. And so we are going to be talking about pelvic health and talking about pelvic floor therapy. And we have a true expert guest today that I'm so excited to welcome. She is an expert in pelvic floor therapy and pelvic health therapy, a teacher and a therapist, Jody Hendryx. And Jody Hendryx from Sedona Physical Therapy. She holds a bachelor's of science from in biology from the University of Colorado and also in physical therapy from Howard University in Washington, D.C. And she started Hands-on Austin in 1994 with the intention of providing a specialized manual therapy myofascial release clinic in the Austin community. Jody has extensive training in manual therapy techniques, which addresses the fascial and connective tissue system with an emphasis on treatment on male and female pelvic floor. Jody has been teaching various manual therapy classes, including Introduction to Myofascial Release and Treatment of Women's Health with the Austin Massage community. She's a full instructor with John Barnes and the Myofascial Release seminars. So that's just a little bit about Jody, and welcome. And I'm very excited to have you. Thank you so much for your time and bringing your energy and time into this project. And yes, welcome. How are you doing today, Jody?
Thank you. I'm doing great, doing great. And, I guess I should update that resume because we just taught our first men's health class.
Right. Mm-hmm.
And so, although we've been treating male pelvic floor issues, we actually taught for the first time a men's health pelvic floor class, which was fascinating. Fascinating.
That's wonderful. And I would love to talk more about that because we sometimes think that pelvic floor, it's for women. It's not. It's for everybody.
All ages, actually. We treat it differently for different ages, but, for all ages, even children will sometimes have pelvic floor issues that could manifest as bedwetting or difficulty potty training, and then all up through the ages. And so, yes, it's treated differently at different ages, but pelvic floor issues are prominent in all of them.
Wonderful. Great. So I would love to hear a little bit more about, your background and how you got into this work and what motivated you to, devote yourself to, focusing on pelvic floor health.
Well, I started physical therapy school right after I'd had my first baby. And so it was one of those things where I actually didn't expect to get pregnant, and I also didn't expect to get into PT school. I had already had a bachelor's in biology, and I didn't want to work as a biologist. I knew I needed to go on. So I had my first baby. My first baby was a C-section. And then in PT school, I got pregnant again. And so by the time I graduated physical therapy school, I had 2 babies, both by C-section. And I was a classic case of pelvic floor dysfunction and really didn't know it. And so this was in 1984 and 86, and in PT school we didn't deal with pelvic. We didn't address pelvic floor issues in PT school. That wasn't one of the things that we talked about, and so I started having a lot of bladder infections after the second C-sections, and that led to bladder urgency and frequency, and then more incontinence. And, so I started getting training in the myofascial technique about 2 years after getting out of PT school. And part of our training, part of our training is we actually do hands-on on each other. And even without addressing the pelvic floor directly, my bladder was actually affected in a positive way by the treatments. And so as I was getting trained, and part of how we train is we evaluate the person that we're going to treat. And so as I was getting trained, pretty much it always came up that my pelvic floor was a problem. And so I was getting pelvic floor therapy. And this was at a time when it really was not very prominent at all. And I was really improving. And so I was working out I had a private practice clinic. Eventually, actually, my private practice started in 1994, but there were very few therapists that did pelvic floor therapy at that time. And because it had such a powerful impact on me, and such a powerful impact on the issues that I was dealing with, I started bringing it into the clinic. And so that's kind of how I started. And I think too, I had a lot of passion about it, because by the time I really realized that my problem, it's like initially, I was the classic example of I'm ignoring it. I'm embarrassed about it. We're not going to talk about it. Don't bring it up to your doctor. All those things that we hear. And so I was a classic case of that. And so I was very passionate about getting this information to people, because it made such an impact on me and my overall health. And so, and because I had such a good outcome with it, I think that I could kind of portray that to people and give them hope. And, this was at a time when, people were saying, oh, bladder issues, that's just normal. You just learn to live with it. Oh, that's I have just the normal amount of incontinence. Well, there's no normal amount of incontinence, So all of that really, really impacted me and affected the very early part of my practice. And so, because there were so few people who were doing it at that time, even the American Physical Therapy Association at that time, they really, their pelvic floor and treatment for incontinence was mainly catered towards people who were in the nursing homes, not, postpartum women of all ages who were having these issues. So it was actually a pretty, it became something that became a very active part of my practice, because there weren't a lot of people doing it.
Mm-hmm. Yeah, and I think that you were coming from your personal experience, and I think
Right.
that really allowed you to connect with people and really say, this really works. If you need help, and sometimes because it is an intimate issue, let's
Totally.
be honest. Obviously, we have to find a way to talk with our clients about it. So I'm curious, how do you, when you have somebody that you suspect pelvic floor would be actually helpful, how do you even start talking about it?
One of the things that I think is really important is that you have to address people where they're at. And so you can't take people where they're not willing to go. And so it's like with everything in our practice. I'm changing, because the light's getting kind of crazy outside.
You're in beautiful Sedona, by the way. We didn't say
that. Yeah. So the light's getting a little. Can you see me okay here? Is the light okay, or do I need to?
You're a little bit in the shade right now. Maybe if you move
Tell
away from the
me.
window. That's getting better. That's yeah. Oh, that's better. Yes, thank you.
All right.
That's fantastic. Thank you.
Let me just bring my chair around.
Yeah. Jody's in Arizona. I'm actually in Florida right now, so when it already got dark. But yeah, Arizona has a lot of light, you
Sorry.
guys. So
All
it's all
right.
good. It's
All
all good.
right. So, how do we address it? Well,
Hmm.
it's really important to meet people where they're at, and so um, the way we address it. Well, first off, now, of course, pelvic floor is not so. Most people have heard. Many people have heard about it, and so people who have these issues, like whether it be pelvic pain or incontinence or interstitial cystitis. I mean, there are so many different diagnoses that we deal with it. Um, I think a lot of people are kind of getting to the place where they don't want procedures, they don't want medicine, or maybe they've already gone that route and it's not been effective for them. And so, there are many books out on pelvic floor now. I mean, it's in the media. You can Google it and find it. So people are coming more aware now. And so, but if they're not, oftentimes what I'll do is I get them comfortable with the work first. So, even even external pelvic floor work can be very effective. So I get them comfortable with the work first and comfortable with me. I mean, honestly, if as a therapist, it's very important that our clients trust us, right? And once they feel the benefit of the work, they are more apt to trust you with the information that you're giving them. And for me, to me, knowledge is power. So, I feel like people need to have the tools to change what's going on in their body, whether it's pelvic floor or anything else. I mean, even with the work we do, I think myofascial release and the manual therapy and all these different techniques are absolutely amazing and helpful for all kinds of different pain patterns. But it's not a passive thing that people have to be involved. And it's not like you get off the table and you're done. They have to be invested in doing some of the work to change the patterns that have been developed in their body. So that's where my first treatment almost always has a lot of education. And I take the time to show a model of the pelvic floor and where the muscles are and how close they are to the hip and the back and how they interact with each other. And so if they are hesitant, oftentimes when they see that, that gives them a better understanding. And so if they're hesitant, again, I never want to drive anybody away. It's like one of the things that I say, again, take people where they're at, you plant the seeds. And, if somebody is resistant, they could be resistant for many different reasons. They could have had, a trauma or something that is difficult for them to address. They're not ready for whatever reason. And so taking people where they're at and giving and educating them and getting them to understand the education piece generally will give them the tools they need to make a good decision.
Hmm. Yeah, very good. Thank you so much.
Something just happened. Hang on. Why did you go away?
Did I go away? Oh my goodness.
Yeah, you went away, and I don't know.
I feel like I'm still here.
I can't see you.
You cannot see me. Okay.
No, I can't see you. I know I can hear you, but I can't see
We
you.
are broadcasting. I'm on the screen.
There's let me just see. Maybe I need to reload. Oh, there you are. Okay. I don't know what happened. Something happened.
Technology, right? And we were
Right.
talking a little bit about technology and teaching classes online, which is another challenge we like coming across right now. And I think as educators in the physical therapy realm, it's becoming an interesting subject. But I think we can talk about it later. But I still wanted to kind of expand more. So you mentioned a few very important things, and education and the power of really making it, like I always think about it, bring it to light, because even now when there's more knowledge and there's more, sort of in the medical world, there's more sort of like, there's more talk about what pelvic floor is and why it is important, but still, there's a disconnect between just sort of knowing what it is and actually allowing somebody to treat you and understanding why it may be important. So I really appreciate you mentioning the educational part. But he also mentioned that, we come into therapy as clients, as patients, with a whole baggage and history. And obviously,
Right.
it is a pelvis for both men and women can be an area of trauma, of memories, of things that we don't even want to face. Um, so how do you what kind of language do you use? How do you explain to clients, why, how the body and mind and emotions may be connected?
Well, that's, I think, the beauty of having the early part of my days starting in the connective tissue world. So I think the other thing I didn't mention is when I got out of PT school, I actually started treating neurologically impaired children birth to age 3.
Mhm.
And that's why I got involved in myofascial, where I was looking for hands-on techniques. And so learning about this work, it's like the connective tissue is continuous from head to toe, and a lot of people think that connective tissue is this tough stuff that sits like, you cut open a chicken and you see this like shiny stuff. That's superficial fascia. Fascia goes all the way through to the cellular level, and it's the immediate environment of the cell. It's the transportation system for the body, and fascia doesn't. It's very, very dense. It could put up to 2,000 pounds per square inch on pain sensitive structures. So when connective tissue tightens down, and it can tighten down for many reasons. It could tighten down from accidents, injuries, trauma, positions held over time, and that means just poor posture, poor body mechanics. Emotional trauma. What happens with emotional trauma? If somebody is getting yelled at a lot, what do? They go into more submissive postures, and the connective tissue will tighten down in the positions that we are holding over time. And so not only does it tighten around those structures, but it tightens over blood vessels, nerves, and it's not only the muscles, it's the organs, it's the organ systems. And so because there's only a little bit of elastic component within the connective tissue, and it's much more of a fibrous collagenous. Okay, so we can't bully it. Okay, so and it changes actually by a chemical reaction, and the chemical reaction is because connective tissue is got a piezoelectric quality. When we compress it, there's a flow of electrons from those cells that signals a release of a chemical called interleukins. And interleukins are inflammatory mediators that signal the release of red blood cells, and the red blood cells are hydrating dehydrated tissue. But they are also, so when and it's very well known now, and it's been proven in research that memories and emotions are actually held within our tissue also. So when we have an injury, whether again it be physical, emotional, spiritual, whatever, that memory can be repressed and held. And then when we open it, it could actually, that memory could come through. Now, and so in just explaining that to people, number one, as therapists, we have to really kind of be able to listen to the people that we're with and kind of get an understanding. When we ask questions about, I ask direct questions about, certainly about, medical issues, surgeries, physical traumas. I also ask about emotional traumas, sexual trauma. I ask all those questions so people have the ability to answer and bring it up. And if somebody says right off, people will often say right off that, they'll start talking about some of these traumas they've had in their life. And the way they talk about them lets you know to some way, shape or form, if they're open, how open they are to exploring it, in a deeper level. I truly believe that the body doesn't allow anything to come up that we're not ready to deal with, right? But I also don't want to expose somebody to something that they're not ready to deal with also, because it could shut the door for further down the road.
Yeah.
So I ask direct questions, and based on how they answer it, it gives me an idea of what they've, what's gone on in their life, what their life has been like, what they're holding, what treatments have they had to date, how have they addressed this problem to begin with. And depending on how they've addressed it also, if this is like brand new to somebody and it's like it's all new information, I don't like hit them with everything all at once because it could be overwhelming. And versus somebody else who's had, they've already had hands-on work. Maybe they haven't had internal work, but they've had work in the pelvis. They've had external work. And it also, truthfully, it depends on how much somebody is suffering. When somebody is really dealing with incontinence or, something that is actually stopping their life and keeping them from fully functioning, they're more willing to go into an uncomfortable area.
Yeah, thank you. And this is important. If you are a patient who is listening, first of all, find somebody that you do feel like is listening to you and that feels, like you can trust them. And then, just trust that a well-seasoned therapist will not push you too far, but also will create that space where you can be open and, share, because it's not about just sharing, it's about facilitating therapy.
Right.
And the deeper we can go, the more we can heal. But of course, like you say, I think it's crucially important. Nobody will force anything. Force is absolutely the opposite of healing. And especially with the myofascial release treatments, we are taught to never force and to always listen to the tissues, listen to the person, listen to their story. And also, like you mentioned, how do they talk about it and what's their history, what's their verbiage, how they talk about the issues that they may be having. And so just kind of rest assured that if you find somebody that's actually been highly trained and is able to listen and create that safe atmosphere, they will not push you too far. But also they will create that opening where you can maybe go further than you think.
Right.
And that will be truly healing. They can be groundbreaking.
And that's why the education is so important. Like when you give people the background and the education and you show them a model and you show them pictures and first off, it gives, there's a little credibility to your knowledge and it kind of builds a form of trust.
Yeah. Yes. Beautiful. And that's crucial for therapy. Wonderful. So one thing and you mentioned, your story with childbirth and all this kind of the array of issues that it created for you. One thing for me that has been on my mind is the importance of pelvic floor for childbirth and, for women who've went through postpartum and went through childbirth and, all around that. So I was wondering, can you talk more about it, why it is important? And I feel like it's not always addressed. Obviously, having a baby is a big deal, and there not always is a lot of time. If you had a C-section, you may not even think that you had a C-section, may not even think that it's important because obviously there's a lot of things to take care of. And can you talk a little bit more about why this is important and why we should actually, put more attention to that whole thing?
One of the beautiful things about being here in Sedona is there are a lot of people utilize midwives here and do home births. And the midwives here have been very, very supportive of this work. Interestingly enough, they don't have the same education as us. And so they rely on us to assess the pelvic floor. So I've had I have had a couple of midwives who pretty much tell their postpartum women that to get a pelvic floor evaluation by 6 weeks. Now, they can do it sooner if needed. And what's really interesting is there are a lot of changes that happen during pregnancy, obviously, to the body. For one thing, the pelvis has to expand. You get changes in the tensions in the ligaments. And things get moved around. They don't necessarily go back in their right place right when the baby's born. The bones don't necessarily go back in the right place after the baby's born. And so here's new mom who's got a brand new baby the hormones are still active, especially if they're nursing. So there's not good integrity there. They're sometimes they get good help and support, but a lot of times they don't. A lot of times maybe you have somebody for a week or two, and then mom's alone with baby and having to lift baby carriers and do laundry and put baby in and out of a crib, and making sure the pelvic floor muscles are working properly. One of the functions, there's 4 primary functions of the pelvic floor muscles. Okay, one of them is, and a very important one, is that they support the organs. So you've got a growing uterus, okay, that's moving all the other organs out of place, okay, and the ligaments are changing their elasticity. And after the baby's born, they're not necessarily going back. So this different tension in the ligaments could cause the organs, the bladder, the uterus, to not be positioned exactly right. They could start to drop also because the nervous system, the weight of the uterus on the pelvic floor, then it's like it sometimes changes the ability of the nervous system to know what to do properly for the pelvic floor muscles. The pelvic floor muscles lift and support, and they relax. And oftentimes the pelvic floor muscles get out of balance, and they're not actually able to do their job as well. So that stabilization of the lumbar spine and pelvis is really important. They provide support for the organs. They provide sphincters. It's a part of those are pelvic floor muscles also, and they provide sensation. So sometimes after pregnancy, there will be pain. Let's say there was a tear, and depending on how that tear heals or doesn't heal, it might be uncomfortable for them to resume intimacy with their partner again. They could have some prolapse happening because of the downward pressure that's happening. And prolapse is where the organs start to drop. And oftentimes that's not picked up until, it's seen. And so if we do a pelvic floor assessment, we can check and make sure there's good integrity in the muscles, that they know how to engage them properly, how to relax them properly, that they're balanced, that the structures are balanced, and that they could start doing the things that they have to do and utilizing those muscles properly so that they don't have further injury.
Mm-hmm. Yeah.
So that's really important. There's actually kind of a movement out there right now, at least I hear it a lot. Well, actually, I was going to say here in Sedona, but actually I'm hearing it more. It's like they're talking about a 5th trimester. Then, in other words, after the baby's born, another trimester, so that we realize that rehab and period of time is just as important as the other, and the care, postpartum care, the importance of it. And bringing that to light, because that is going to prevent problems later on. Some of these issues with incontinence and pelvic pain and prolapse started much, much earlier than when we find them.
Mm-hmm. Great. Yes. So, it's never too early.
No,
and
never too early.
What about pelvic floor work during pregnancy?
Pelvic floor work during pregnancy. A lot of women, again, remember, we don't go into pregnancies with perfect bodies. And so we have the body's changing, everything's widening, the shape of the uterus is changing. There could, the body has to accommodate this new life coming in, and a lot of discomfort can happen. And so getting treatment, for a pregnant woman who's having back pain or, bladder issues or, any type of pain during that time is really important. Sometimes internal work is helpful during pregnancy as well. And, that's one of those things that the way I learned it, and I know that there are different schools of thought on it, and this is totally fine. There are some people who, the way I was taught is that treatment during pregnancy is totally appropriate as long as it's not a high risk or there's not a problem with the pregnancy. It's obviously really important that the safety of the mom and baby is paramount. Now, most women are sexually active during pregnancy, okay? Pelvic floor work is a lot less vigorous or, than any type of sexual activity. So, and again, as long as the therapist knows what they're doing, and, so one of the things that we found very important is remembering that there's these, if there's an imbalance in the muscles, we can't change things as dramatically. We definitely go a little bit easier and slower with pregnancy because of the stabilization issue. We don't want them to lose stabilization. So, and again, it depends on how far they are into their pregnancy. But very important during pregnancy, as it gets close to birth, helping open up the perineum, the pelvic floor, making it more elastic, teaching them and their partner how to do that, so that there's a successful birth, maybe less tearing. Also very important.
Mm-hmm. Yeah, so it can be crucial, and I believe that it can also help women who actually had previously had C-sections to have natural birth, right?
Right.
What is your take on that?
Absolutely. I mean, their VBACs are happening now, and not only are they happening in the hospitals, but home births. They're doing VBACs, and so so this is they've not had a baby come down the birth canal, and so to be able to have that success and to have a good elastic pelvic floor with good blood flow. Very important. So absolutely.
Yeah,
absolutely. I'm a big one on teaching partners how to help with that too. I really feel, so whether it be, pelvic floor work is something that can be, it's harder for us to do it on ourselves, although we can do some on ourselves. But if we have a partner that can help, it can be really, really beneficial. And so supporting the work that's done in the clinic or, with the partner is very, very helpful. So I teach partners how to do what I'm doing in the clinic.
That's great. That's wonderful. And, it probably has an incredibly beautiful impact on, on the connection and between partners. And so it goes way, way beyond just, obviously physical issues are extremely important because you want to be healthy and well in your body, but it goes beyond that.
Right. Especially pain with intercourse, which is called dyspareunia, right? So how does it happen? So it's many, many cases of where partners had a healthy sexual relationship prior to pregnancy, and then after pregnancy, after birth, all of a sudden it's not comfortable. And so what happens when it's not comfortable? Well, you start avoiding it because it's painful, and then maybe it's not talked about because you're afraid of hurting feelings, or there's a lot that's changed in the house. So then there's often a lack of communication about the subject because it's not a comfortable subject. And so the more we avoid something and the body knows it, again, here's a motor pattern that's developing, not only a motor pattern, but an emotional pattern in the body. So working with that pattern with a partner is really important. And I almost always, if somebody comes to me who's got that problem, I say, it's really great if you could bring your partner in, because it's not only, there needs to be some communication with the two of you to change the pattern that's happening in your body. I can get you totally great and open here on the table, but when you go back home, your body might automatically react the same way because that's what it remembers. Yeah. Just like getting a shot. Yeah, just like getting a shot. Somebody comes at you with a needle, you're gonna clench. So if the body remembers something's painful, it will react in that way. And so teaching the partner how to engage and help with that problem is really, really beneficial. For me, dealing with my problem, I was very fortunate that I had a partner that was willing to help me with that. And so, especially at that time frame, I had to travel to get that type of work. And so obviously I couldn't go twice a week. And so having a partner that was able to help me and do some of the work in between was a big part of how, I was able to continue to make the progress in between treatments.
Great. Wonderful. And so you also, so we are talking about women and pregnancy and, you know, the entire, everything that may be going around it and having an impact on the pelvic floor. But you started to mention partners, and you mentioned also that you've been teaching about male pelvic floor. And that may be a bit of a more tricky issue, because I think we're more used to, you know, women need pelvic floor, you know, because obviously of pregnancy and menstruation and all that stuff. But
Mm-hmm.
why would men want to look for that?
So when I first started in this work, that time, the male population was mostly older men who were post-prostatectomy, and those pretty much were always, well, you had incontinence and sexual dysfunction after that procedure. I noticed a big change, and I think when we really changed our workforce to a more sedentary, we're working on computers, and especially with what's changed in our culture, there's a lot more stress. People are sitting on computers a lot more, not only for work, but for play. There's a lot of compression. We're seeing a lot more younger men having pelvic floor issues. So what are some of the issues that younger men have? Well, pain. They get testicular pain. They get testicular pain, groin pain. They could get pain with erections, pain with ejaculation, erectile dysfunction, prostate issues where the prostate enlarges. And there's issues with urination, so intermittent urine, or like dribbling that happens where it takes them longer to empty their bladder. The urethra goes right around goes through the prostate. And so if the prostate starts to enlarge and harden, it puts pressure on the urethra. You know, I'm going to say this from a manual therapy perspective, and I know that this is from our perspective. A lot of the issues that happen in the pelvic floor are because of compression, congestion, and stagnation. What does that mean? Compression, well, it's obvious. What is compression? Things because of gravity, and the lower part of the spine is prone to compression, especially when we sit a lot. But gravity also creates compression. Congestion, there's a lack of blood flow. So it's sort of like the difference between a clear running stream and a stream that's got a lot of debris flowing in it, right? So the more stagnation that you have, the less aeration you have, okay? So in our case, the less oxygenation that we have, the tissue's not going to be as healthy. So less blood flow in, less release of toxins out, right? So basically, you know, it's like, well, I think somebody made a teacher made this this thing once. It said something like, you can have a party and bring in the best food, but if you don't take the garbage out for a week, things start to stink. And so that's the thing with the body. If we don't get good aeration and good elimination, we get stagnation and congestion, and the tissue is not as healthy. And so that can affect the prostate, the pelvic floor. So even in young men could start having prostate issues. Athletes are known to actually have more, you know, so here they are, very strong, right? But there's too much tension in the system. You know, exercising incorrectly. So young people who are doing a lot of like hard ab work and glute work and leg work, you know, great. I mean, there's a good cut, you know, it's like we're taught that, you know, our culture likes to see these hard, firm bodies. But the thing is, if we don't have balance in the tissues, that we could create problems for the area that, you know, our muscles and structure is not just for cosmetic. Our abdominals are not just so that we look good in a bathing suit.
We have six back. Yeah.
Right? Our abdominals are there to massage our internal organs, right? And they work as a couple with the glutes to support our back. And so when these are really hard, then we don't get that proper support. And a typical thing, even with very strong people, is imbalance, where, you know, one side is the muscles aren't working in a balanced way. And often that's because we're not exercising correctly. We like to exercise, we like to get the burn, but we don't always get the balance.
Right. And remember, I mean, a tight tissue is going to create weak body.
Right.
It's not, yeah. Tightness doesn't mean strength.
So yeah, there's the thing. It's like what strength is a length tension relationship, right? So the more length you have, length can generate tension. If it's very, very short, we're not going to be able to generate more tension. If it's overly long, we're not going to be able to generate tension. So it's a length tension relationship.
Yeah,
Right?
very good. Yeah, and that's so important. I think I really appreciate you bringing all those issues because, first of all, I think that sometimes things get too complicated or more complicated they need to be. I mean, it can be as simple as releasing some of that tension, with manual therapy that is not invasive, that it's not painful, that is,
Right.
it's like myofascial release in most of the cases is light pressure. It's not painful, it's not traumatic to you. I think that there still may be this whole thing about
No
that
pain, no
manual
gain.
therapy is going to be, yeah, exactly, but it doesn't have to be that. But then it's not just for older men and women who had babies. It can be for, like you said, anybody. And even if you're struggling with actually getting stronger in I don't know, if you lifting weights and you are having some problems with your hips and maybe not getting all the technique that you want. And well, think about the pelvic floor.
Right. Right. And it's interesting. So our medical system has the unfortunate effect of cutting our body into pieces and not looking at it as a whole. And even our profession as physical therapists, I have to say we're as guilty of that as well. So everything is connected. The connective tissue is continuous from head to toe. If I'm sitting back on my pelvis, my head and neck is going to be affected because of that. My shoulders are going to be affected by that. And so proper body alignment, it is a whole body function. And so our body is meant to be in balance, and it learns to, but it also learns to compensate. So there's oftentimes a lot of little micro traumas that are happening in the body that we don't even know because the body's compensating for it. But it can only compensate for so much. And then, oftentimes we'll have a symptom show up and we think that's the problem, but that's not necessarily the problem. That was kind of like what came out on top. It's kind of like that old game of the straw that broke the camel's back. You have all these things. I mean, a classic example is, somebody bends over to pick up the newspaper and their back goes out. Do you think the newspaper made their back go out? Our bodies are generally are compensating all the time, and they give us that grace. And if only we would learn to listen to them and take the messages. Oftentimes pain is a signal that something is out of balance. Many times we don't use that signal. We don't use that signal. We look to shut the signal off. What do? We take a Tylenol or an anti-inflammatory. We go to our doctor. You go to your doctor because you have pain in some part of your body. They're not going to talk to you about what you're doing, how you're doing, look at your body mechanics. They're going to give you maybe they'll send you for an X-ray, or they're going to look at the body in a very, very kind of narrow focused way and give you something to take care of the pain. And if the pain goes away, well, then no problem. But oftentimes they're not looking at what is the cause of this, what's brought this on. And so that's one of the things that I think that manual therapy is really beautiful for, is that we've learned that it's oftentimes where the pain is not necessarily where the problem is, and that we're trained to look at the whole body because of that. And so it is a beautiful way to get a communication with the body and learn how to be proactive in our own care.
Yeah. And, we talk about trauma, but trauma doesn't necessarily mean that there's been sexual trauma. There's
Right.
been something really, very, huge happening that maybe you remember. It may be as simple as, like you said, sitting down and curling up, and watching the computer screen all day long. And that's actually a huge amount of trauma into the body. It's just, we're not quite taught to connect the dots yet. And that's why I appreciate, I really appreciate your work and explanations, with your educational efforts, that, we need to connect those dots, because life can be much easier for us, I think.
Right. I call it big T's and little T's. So big T,
Mhm.
big traumas and little traumas. We have little traumas all the time, right? I mean, a mom carrying a baby on her hip, let's say, or stepping over a baby gate repeatedly, right? These are repetitive patterns that are putting the body out of balance, you
Yeah.
know? So, a new mom, caring for a young baby, getting less sleep, the body has gone through so many changes. And so, there's all kinds of compensations that are being made. Nursing a baby, what is the position of going into, into nursing? That's obviously being repeated multiple times a day. So that's where I think, the education piece is really important, and empowering people to learn to listen to their body and take the messages from their body for all things, pelvic floor and everything attached to it.
Beautiful. Yeah. And what I also appreciate, it doesn't have to take, 2 years of treatments. It can be several, a few treatments. And then, you're teaching people how to take care of themselves, self-treatment, and also partner work. That is huge, because this is where we actually take things in our hands, and the patients can actually become independent and empowered, like you said. And that's the whole point. It's not about,
Right.
it's not, I think that another maybe obstacle, and sort of like an issue that people may have, is like, okay, well, I'm going to go into therapy, and like, how long is it going to take? How much money am I going to be spending? Like, is it going to be like 3 years of going every week? But it's not. It can be as simple as a few treatments, right, with releasing some tension. And it
Right.
depends on the store, of course, on the case issue. But
Right. That's where, we're living in such a different time now. Very, when I first got into this work, insurance actually was reasonable and paid for care for people. And we're seeing it doesn't as much anymore. It just doesn't. And so most people, even, a lot of people don't have insurance. And even if they have insurance, it doesn't cover a lot. And so people are having to pay more out of pocket. And so making it so that people can, that they can have things to do at home and to follow up and to have the knowledge and the education to be able to follow through is really important. And not only that, but busy lives. A new mom, with caring for a baby or multiple little ones, doesn't always have the ability to come in multiple times of the day,
yeah,
multiple times of
exactly.
the week, right? Yeah,
Exactly. Yeah. So, this is really, it is for you. If you're a patient, if you're somebody who's looking for answers, it is for you. And I mean, we're here to actually make it easier, I feel, and make it more accessible. And not, even if we're talking about money, it's not as expensive as you may think. Because, I mean, obviously it's worth it if you're thinking about the future, and like, how much you can prevent in the future. So this is also important. So I appreciate you kind of bringing up all the educational aspects of your work too, because that's hugely important.
right,
Lovely. So
right.
is there, if you were to leave us, with some advice to a person who may be kind of thinking about it but not sure, like, what would you say?
Well, what I would say is that I think that most people would benefit, and most men and women, but especially women, would benefit from a pelvic floor assessment. And if I had my druthers, I think I would want it. I would recommend it, that it's part of your regular wellness care, because it has so much to do with the vitality of our system. And so I think pelvic floor care should be part of our regular care. I think that both men and women need more education in it, because it really does have such a vital part in our wellness, in our functioning, in our vitality. And there's so much that we can change that affects our lifestyle. in a positive way. Incontinence, pelvic pain, these things affect your lifestyle, and so having the ability to change that is, I think, I mean,
Good.
you can't put a value on that, right?
No,
Yeah,
it's your life.
it's your
Right?
life.
Yeah.
It's your life.
Wonderful. So if people want to reach out, how they can get in touch with you? Maybe if they're in Sedona area, or if they're interested in taking some online classes, or just connecting.
So I do have a website, and so my website actually has some great resources. I have some really good blog articles. I've got some great videos. I've got a resources page that has self-care tips. I've got a couple of videos on there that show how to do certain things, and so the website is a great resource for help, and as well as getting in contact with me. And it's Jody at SedonaPhysicalTherapy.com. And as far as classes goes, we're just kind of getting back into figuring that out. We had a little break, so we just did a men's and women's health class, and so that I'll have to get back to you about, because I do that through another practitioner who I know you've interviewed most recently, and so the Myofascial Academy.
Yeah.
That's here
All
in
right.
Sedona, right?
Great. So, I mean, I'm going to put your website in the notes to the recording, so everybody can connect with Jody. Wonderful. Well, great. I mean, I really appreciate your time, Jody. I know we could talk about, I mean, these are not issues that you can cover in 45 minutes, obviously, but
No,
I think the goal was to bring some ideas and some inspiration to people who maybe, are looking for answers, and just, I think that you probably, listeners, I hope that you got, you understood that there is something about that pelvic floor that may be really worth looking into, and
absolutely,
inquiring, at least, if not actually reaching
absolutely,
out to a specialist, because you don't have to go through pain and difficulty through the rest of your life. I mean, a lot of those issues are actually not that difficult to help,
right,
and don't take forever. So I think that's my message, that you can totally help yourself, and it does not take that much time or effort. So
right.
we're here for you, and I know Jody's here for you. And if you're not in the Sedona area, just look for somebody in your area. Look for myofascial release pelvic floor. Look online, ask around, and you will find somebody. And just make sure it's somebody that has been educated properly, and that is you feel comfortable with, that you can, yeah.
Yeah, I think that's probably the last thing I would want to say is, I do want to let people know that not all pelvic floor therapists treat the same way. So, typically myofascial therapists who have pelvic floor training, who are also trained in connective tissue myofascial work, kind of treat from a whole body perspective. And that's really important for overall good prognosis and function, because the pelvic floor does not stand alone.
Yes.
Unfortunately, in our fast food medical society, oftentimes the conventionally trained pelvic floor therapists kind of treat more narrow focus. They only treat the pelvic floor. They don't look at the rest of the body. You might get some, you might not have the same benefit. So if you go to a therapist and you don't get the results that you want, I would encourage you to not give up there.
Yes, exactly. Don't just think that that's it, and that's
Right.
the end. Look out, look for other support. Look, educate yourself. There's plenty of resources, and look at Jody's website to start with. So
Right.
we're gonna share it. Well, fantastic. Thank you so much for your time, and thank you, Jody. Thank you, everybody, for listening. And we're gonna be back soon. All right. Have a beautiful day. Thank you.
Bye-bye.